Hi everyone. So I wanted to talk about my first pregnancy update. I'm 14 weeks today. So this is my second baby and I've had my first doctor's appointment at 12 weeks. And this will be my second time with gestational diabetes. They sent me in to do my appointment at around 12 weeks. So that's when I went in and I had to do the 1 hour. I went in, did the 1 hour, got a phone call that it was, so I came in to do the 3 hour, and for my fasting was 90, which they said was good. And at my 1 hour, it was 200, over 200. My second hour was over 400. And my third hour was around 140. So at 13 weeks, I have gestational diabetes again with my second baby, and it is not fun. You can't eat anything, and you're on a strict diet, no carbs, basically wraps, chicken, vegetables, not even that many fruit, no soda. Pricking myself 4 times a day, even though my sugar has been good because obviously it's my second time and I know what I'm supposed to eat and what I'm not supposed to eat. So, I don't know, we'll have to wait and see what the doctor says. I won't be going to talk to them until I am 16 weeks, so in about a couple weeks. And last pregnancy I was on half a pill of Glyburide, I think it was called, and that didn't seem to help at all, so I'm hoping this time I won't have to get insulin because that's not fun. And supposedly once you're on insulin, you're more susceptible to having diabetes once the baby's out and you have it for the rest of your life. So I'm really buckling down this time and making sure I'm eating good and not eating any sweets. So, like I said, this is my second baby. We'll find out around 16 weeks what we're having. We're going to be doing a gender reveal. My first baby's a girl, so, and her name is Gemma. She's 1.5. So this baby is actually due on her due date of April 3rd, which is Gemma's birthday. So we'll see. We're hoping for a boy so we can be done with babies, but I'm having a feeling it's a girl this time again. But like I said, with gestational diabetes, it's kind of hard to know if it's even safe for me to have a third baby, but I also had a lot of complications after birth with my first child, and I can do a whole video on that. Basically, blood on the brain. They had no idea what was wrong with me, so I will eventually put that video up of her birth story. But yeah, 14 weeks. I think I've gained 4 pounds. Not much else. A little bit of heartburn, but nothing too serious. Already feeling kind of the sore muscles when I sleep. I'm always tossing and turning. I will be going to stay with my parents in a couple weeks after my 16-week appointment. My husband's going to be going for training for a month. The joys of being an army wife. But it's all good. We get to go hang out with my parents in Florida, go to the beach. So that'll be fun. And she gets to see all of her family members and his parents. So there's always a silver lining to them going away. Haven't felt baby move yet. We do have a Doppler or a sonogram, a Doppler machine. And the baby's heart rate is about 155, so that's kind of why we think it's a girl. So we'll see about that. For me to do this video, I've been watching YouTube videos for about 7 years, and my husband was always like, you need to do a video, you need to start doing videos, stop watching them and start doing them. And I was looking this past week on videos about gestational diabetes, and I kind of wanted to know if anyone has had it twice if it was a good or a bad thing, but I really can't find anyone. There's like a couple of people on here that have had gestational diabetes, and if they have, it's only been their first child. So I want to know that I am not the only one that's had it twice. So if you guys have any questions, let me know. I'm going to start doing these weekly, just so I can look back on my pregnancy with this child, with baby number 2. So if you have any questions, just let me know. I will be happy to answer them. And you'll be starting to see a video from me every week. And we'll update together. I'll show you the belly. I have a dress on, so you won't be able to see much, but it's tiny. So thank you for watching, and put your comments, questions down below. I'd love to hear from you guys.